My name is Dr. Heather Geest. I am a naturopathic physician in Vancouver at a clinic called Baseline Health and Wellness, which is on West Broadway. I will show the slide at the end as well, in case you want that information. So here's also my own disclaimer. So the information presented in this presentation is not to be taken as medical advice. It is important to see your own doctor in order to make the right decisions about your health. And it's meant to be educational in nature, and it's not meant to diagnose any kind of specific condition. So who am I? I have a Bachelor's of Science in Neuropsychology from University of Victoria. I attained my Doctor of Naturopathic Medicine from the Boucher Institute of Naturopathic Medicine in New Westminster. And I'm just coming up to 3 years of practice with that. I am licensed and registered with the College of Naturopathic Physicians of BC, the BC Naturopathic Association, and the Canadian Association of NDs. And I'm certified in advanced injection therapies, IV therapy, prescriptive authority, and acupuncture. I was an athlete on the Canadian national rowing team in 2003 and represented Canada in the women's quad. I also was the captain of the UVic women's Vikes for 5 years while I went to UVic, and I love swimming in my spare time. And the reason I am doing this presentation today is I was actually diagnosed with type 1 diabetes when I was 8 in 1995. So I would like to say I am still complication-free. My diabetes anniversary is March 8th. And so that'll be 26 years. And so right now I'm 25 years so far and still going strong. These are my areas of practice that I focus in my naturopathic practice. And today we're really just going to be focusing on diabetes management. So as a naturopathic physician, I'm always looking at treating the whole person and getting to the root cause of somebody's symptoms. And as you can see in this like pyramid diagram here, it's really about establishing the foundation of health at the very beginning. That's our foundation of what kind of allows us to move forward as we're treating a patient. So today I'm primarily looking at really adding that building blocks and that foundation for you on establishing the foundation of health. And then we will go into some like supplements to support your system and other things you can do to help. And what I do want to say is that this information in this presentation isn't only for during the pandemic, but really just general health information that you can take in any day, any year with your health. So a little bit about chronic disease, because I am going to talk about chronic disease and diabetes, but chronic disease is defined broadly as a condition that you've had for 1 year or more. So it's either an ongoing medical, it either needs ongoing medical attention or it limits the activities of daily living. Chronic disease, such as diabetes, heart disease, or cancer, can be the leading cause of death and disability in the United States. And I, as a naturopathic physician, am looking to either, if people do have diabetes complications, to help prevent further ones and let them and help them to live optimally, or if you are pre-diabetic or you have a family history of diabetes, those are the people I love working with because it allows me to take that preventative approach to actually helping you prevent that disease from coming on. So many chronic diseases are linked to a number of diet and lifestyle factors, especially poor nutrition, including like not enough fruits and vegetables or high in processed foods or sodium, a lack of physical activity, smoking, or alcohol consumption. So what is diabetes? It is a disease of the body, and it's either a lack of insulin or the body not actually able to use the insulin effectively. So insulin, I like to think of it as a lock and key. So the lock is like our insulin receptor cells, and the key is the insulin. And when we're talking about the two types of diabetes, we have type 1 and type 2, and both involve the body's production of or sensitivity to insulin. And insulin is that key hormone that's needed for their survival. I'm not sure if anyone knows where the term diabetes came from, but it actually came from the term sweet pee, as in sweet urine, because both type 1 and type 2 do suffer from blood glucose abnormalities, whether it be a lack of insulin or insulin sensitivity that causes those high blood sugars. And on the other hand, if we overcorrect either with medication or insulin, that can then also lead to low blood sugars. So diabetes is just a dysregulation of blood sugar, and that's why type 1 and type 2 are both considered diabetes, even though one may be producing too much insulin but not able to use it, and the other one's not producing enough. So differences between type 1 and type 2 diabetes, as I type 1 diabetes is that the body is not producing insulin. And it's usually for type 1, they're not producing any, although some people may produce some. And so that it's like we have the lock, but we don't have the key that unlocks that lock to allow the glucose to get into the bloodstream, or from the bloodstream into our muscles. Okay. And that's what our body needs in order to be able to be fed. With type 2, there is sufficient insulin secreted, but so they have the keys, but they have a broken lock. And I will discuss that more as we go, but it's not able to allow it from the bloodstream into the muscle. So type 1 diabetes, the exact cause of it is unknown. It's known, it is an autoimmune condition. So, I mean, the way that they think I got diabetes was as my body was fighting off chicken pox, it also fought off my insulin cells. And those insulin cells are the beta cells of the pancreas. And when the body has that autoimmune response to attacking that, the body then no longer is able to produce insulin, and we have to take it by needle or insulin pump. So diabetes is thought, type 1 especially, is caused by a combination of genetic factors and environmental factors. So it's not just saying that the chicken pox kicked it in for me, but it's also, so that was the environmental factor, but I must have also had that genetic factor that made me more susceptible. Type 1 is usually, and I say usually because there are some exceptions, it's usually diagnosed in childhood or early adolescence. When we're looking at risk factors of type 1, some can have a family history of it, although that's not always necessary. The environmental factor and the presence of damaging the immune system cells. So the body builds up antibodies against its own self. And certain areas of the world, such as Finland and Sweden, have a higher rate of type 1 diabetes, and they're not sure why. Now, when we talk about type 2, it's like we have a broken lock. So some people may get that diagnosis as pre-diabetes, which then can lead into type 2 diabetes. And it's where those insulin cells are resistant to those keys are resistant and not able to get into that lock to unlock the cells to allow the glucose into the cells, such as like the muscles in that previous diagram. So type 2 diabetes can either be that you're producing too much insulin and it's not able to get into the system, but that slowly starts to wear away at the body, and then they may not be actually producing enough insulin after the body gets fatigued with that, and they may need to be on insulin or some other insulin sensitizing medication in order to help those cells be more receptive. So type 2 diabetes, as most of us know, is usually, it still has those factors of like genetic or environmental, but it is more lifestyle based. And it's usually diagnosed after the age of 40 and is often associated with obesity, high blood cholesterol or triglycerides, and hypertension or high blood pressure. And when we're looking at risk factors for type 2 diabetes, we see that a lot of them are lifestyle driven. So if there is extra adipose tissue or fat tissue on the body, that makes us more resistant to the insulin that we have. And a person would need to either be producing more in order to actually absorb it. Also inactivity. So if you're not active, so physical activity really does help to control weight as well as blood glucose levels. Family history, a lot of people will say, oh, my grandparents had diabetes or my aunt had diabetes. There is a stronger link to type 2 with a family history. Age is also a risk factor. Can't really do much about it, but if we're not kind of keeping ourselves at like an optimal range, or an optimal efficiency, they can start to wear out. And that's how you kind of have those like broken locks where the key isn't working as well. Also, if people have had gestational diabetes, and that's diabetes while the woman is pregnant, they can be at a higher risk for diabetes type 2 later on. Type 2 diabetes later on. And so that is just something to consider. And then also different hormonal concerns like polycystic ovarian syndrome. If somebody has high blood pressure, you know that there's many parts of the body that are not working as optimally as they could. And then also abnormal cholesterol or triglyceride levels. So what are the symptoms of diabetes? So and this can be for both type 1 and type 2, but frequent urination, going to the bathroom a lot, increased thirst or hunger, because that glucose is going around in the bloodstream, but it's not actually getting into our cells due to either a lack of insulin or a lack of the insulin being taken up in the receptors. And so people will feel more hungry because their body is technically starving for that food or nutrients that's not getting into their system. Weakness or weight loss can be a sign. The weight loss is more because the body's actually starving even though you are eating, because the insulin's not able to bring that sugar into the cells. Blurred vision with high blood sugars, usually nausea. It's just the body is so dehydrated and trying to suck all of the water out of your system to try and flush out the sugar. And that's why you're peeing a lot as well. Really hydrated and you can get nauseous. Slow healing, and that's just because bacteria love sugar and glucose. So if your blood sugars are high, things that should take a shorter amount of time to heal are taking longer because there is more bacteria in the system preventing that healing. And then tingling in hands or feet, and that's called neuropathy. So it can also make people very tired or fatigued, irritable, mood swings, frequent infections, which kind of goes along with that slow healing. And then this is more a type 1 thing, but that fruity breath or ketone breath, or even peeing out ketones, because what's happening is ketones are a breakdown of fats in the body. And so when the body is starving, because it's not getting the nutrients into the cells, the body starts to break down, and that's what gives off that ketones. And it can also lead to sexual dysfunction due to high blood sugars and not getting proper circulation to the body. So we've all heard of all of these symptoms of the diabetes complications, from eye disease, kidney failure, diabetic foot or neuropathy or ulcers, nerve damage, heart disease, stroke, the list goes on. I have them all here. And one of the things that, it was actually diabetes month, the month I was diagnosed with diabetes. And everywhere that I could go, I was 8. And so I could just see over the counters of, at like most tills at a shopping center. And it would be like cure diabetes or donate to diabetes. And you also cure kidney failure, heart disease, amputation, and the list goes on. And I remember it gives me goosebumps talking about it, but I remember being young and being like, I am going to make a promise to myself. And I told my mom as well, I was like, this is a promise to myself. I'm never going to let these complications affect me. And so I've been very diligent on taking care of my diabetes and doing the very best I can. I'm not perfect. I've had high blood sugars. I've had low blood sugars, all today even. So, I mean, it's not a perfect science. It never will be, but doing the best we can in that prevention and taking the best care of our health to minimize those kind of complications is exponentially important for the body. So I say control measures, but these are the different areas that I want to talk about today to help give you the best kind of support and help in dealing with diabetes. So medications. I listed them all here. So on the left, you can all types of insulin that a type 1 diabetic may take, and then the oral medications for diabetes on the right, which usually type 1 diabetic or type 2 diabetics will start on, and then sometimes move to the insulin if needed. So just going back here, after medications, I want to talk about stress management. And stress, diet, and sleep are huge ones that I'm going to focus on today, because they're things that if we're aware of them and can make small changes, they can make exponential difference in our health. So stress, it causes more health concerns than most people actually realize. It's important to find ways in order to healthily de-stress, such as like deep breathing or meditation, or even just like sitting down and having time to ourselves, or reading a book, or having a bubble bath. What I do want to emphasize is that stress is a normal human reaction, and it happens to everybody. So the fact that humans are designed to experience stress and react to it, and it's whether it's a safety mechanism actually, because if we're in a stressful situation or a dangerous situation, our stress hormones kick in to be able to allow us to get out of that situation. All right. But stress becomes a problem when those stressors are, it's not just in like an area of danger that we're feeling them and then they go away after we, as the example goes, like when you're running from a bear. But in our daily life now, it seems like those stressors are just always with us. We have time constraints, we have to be somewhere, we have work, you know, with our cell phones even, we're always available. And that stress can add up, and those are the stressors that without that relaxation or downtime can really have an impact. And as you can see in this diagram, health issues caused by stress, diabetes, heart attacks, strokes, infections, fatigue, hormone imbalance. I deal a lot with that in women in my practice, and men actually. And between hormone imbalance, digestive issues, because if we're in that fight or flight or that sympathetic response of stress that's like running away from a bear, we're not able to digest our food as well. We're not able to sleep or remember things that we need to remember because our body's in that stress response to get us out of a situation. It can also lead to other mood disorders like anxiety and depression, and fertility and menstrual issues as well, and then autoimmune and allergies. So it's really about curbing that long-term stress. Stress can be helpful to get out of a situation, and it can also be detrimental. So when we're dealing with stress, number one is to prevent it, or not necessarily 100% prevent it, because it is necessary, but finding good coping strategies, giving yourself new choices on how to deal with that stress, and being able to handle it differently. So when we look, it's like, recognize what is causing that stress. Is it something that you need to deal with? Or is it something that you're taking that you could maybe find other ways to deal with? You also want to take note on how your mental, physical, and emotional health is being affected by those stressors. Okay, taking steps to removing stressors in your life or giving yourself other options to dealing with it, and addressing kind of those underlying health concerns. So looking at self-care and stress reduction strategies, we can do everything from diaphragmatic breathing as part of that feedback loop, which is promote that relaxation. If we sit and actually just sit in quiet and can take a few deep belly breaths, we kind of come out of that sympathetic or fight or flight response and get back into that parasympathetic or that rest and digest response. You can also try relaxation activities, which I kind of just mentioned there, meditation, yoga, breathing exercises, or muscle relaxation. Take good care of your body. So as we're going to look at next, diet, exercise, and sleep. Also staying positive and looking for the things that are going well in your life rather than kind of staying in a perpetual cycle of everything that's going wrong. And I'm guilty of it too. There's definitely times, and especially through this trying year of 2020, there was a lot of different stresses. There was a lot of unknowns for many people, from work to their own health to family members. And so it's something that we have to look at what is going well, and then it allows us to kind of give us that boost to deal with the things that we need more support with. Staying connected with people, so whether it be over Zoom like this, whether it be a phone call, or if you are lucky enough to be able to see somebody face to face, that can be really important. Like, I mean, if you have a family member that you live with, give them a hug. You know, it's that social connection that we need. I also put laugh daily, right? So, you know, looking for things that you do enjoy, that do make life a bit better. Regular vacations, that's on my wish list at this point, but it's always nice to put there because this can work for any type of stress, not just during the pandemic. And if you do need help, please reach out, whether it be to family, friends, or your doctor. So let's talk next about nutrients that are depleted by stress. Before we start talking into diet, I like to let people know that a lot of nutrients in our body are depleted and worn out by stress. Primarily vitamin B. B vitamins are our stress vitamin. So if we're even in our car and you have to slam on the brakes, that actually uses up the B vitamins that we have in our body for that day. So if you think about if you had to slam on your brakes in the car and you had a stressful day at work and you have other either health related issues going on, or you're in a disagreement with somebody, that's a lot of B vitamins that are depleted, and those need to be replenished. And primarily, we want to get that from our food. That's our best source. But if we can't get it from food, then it's best to supplement. Vitamin C is huge for collagen production in our body, and it's also great for immune support. It's not the be all and end all of it, you know, and most of us do know about vitamin C. It's like you get a cold or a flu, you take vitamin C and it helps you feel better. But it's also a stress hormone, and it's depleted during stress as well. Magnesium is another one that most people don't think of in a stress situation, but magnesium is great for the body. It's also great for, it's used to actually make some of the hormones and the energy that our body needs. And then potassium is excreted during stress as well. But again, we want to try and get these from nutrition rather than just using supplements as a crutch, but supplements are there if we're not able to get them from our diet. So how can a naturopathic doctor help with this? So a naturopathic doctor can take that individualized approach to your health using the various tools to help our body adapt to stress and to deal with that stress. Interventions such as botanical medicine, vitamins and minerals at therapeutic doses, which I do want to say is on the bottle that you get from the grocery store, sometimes it's not a therapeutic dose because they have to make sure that it's going to be safe for anybody that takes it. But as a naturopathic physician, we do have more training in this to actually be able to individualize that treatment plan to make sure that you're getting a therapeutic dose that your body needs. And adrenal support is another one. And our adrenals are our stress hormone. And they produce cortisol, which is our stress hormone. And so sometimes we need to actually rebuild that as well. So it is important to talk to or consult a naturopathic doctor before taking these nutrients or supplements, because many of them actually can have interactions. They're not fully safe to take with everything. And so you need to make sure that your medications don't interact, even other supplements that you're taking don't interact. So best to consult a naturopathic doctor. Let's talk about diet. So diet is essential to life, okay? How we eat is often the primary indicator of how our health and vitality is. The body is going to process everything it consumes. It's like gasoline for your car. If you put in good, high quality gasoline into your car, you're going to get a lot more output from that car. Whereas if you put what I like to say, like dirt and really like pour fuel into the car, you're not going to get that same performance. Think of yourself like a pristine sports car. And most people, take their car in for servicing, but sometimes people forget to take their own body and health in for servicing and with the doctor to make sure that you are also functioning optimally. So food can be either a medicine or it can be a poison, and everything you put in your mouth is either one or the other. And digestion of food takes time and energy. So you want to make sure that that energy to digest that food is being used optimally with getting good nutrients. Do I have anything else to say about that? Yeah, so in order, there's been actually a few different ways of looking at for diabetes and like what kind of diet should be as best for it. And that's changed over time. So it used to be, actually, let's just talk about what it is right now. So it used to be more on a carbohydrate base, like low fat, but now it's actually switched. It's now into a high protein and little carbohydrate intake. The high protein and low carbohydrate diet for most type 2 diabetics has been able to completely reverse some of their symptoms and eliminate their need for insulin, because we're not getting those spikes of blood sugar with that carbohydrate, and we have a more level energy with the high protein or good quality fats. So diabetics who do need to take insulin may need to take less insulin if they're eating less carbohydrate, and that can really help to manage blood sugars. So healthy choices. Cooking and getting like good nutrients in the food. Organic typically has more nutrients than non-organic, but it really depends. One of the things I look at is even if people can't afford all organic, and neither can I, if you go on to Google and even search the clean 15 or the dirty dozen, and the dirty dozen is the list of foods that have the most amount of chemicals. And if you can kind of look at that dirty dozen list, that can help. Maybe those are the foods that you would try to get organically, whereas the clean 15 have the least amount of pesticides. It's always best. I mean, we live in a society now that you can get pineapple all year long, but or different fruits, but it's important to kind of eat locally and what's in season. That has the most amount of nutrients. It's traveled the least amount of distance and to get to your plate and to keep you healthy. So whole foods are much better than simple or processed foods. And it's always best to eat fresh rather than getting canned or processed again. Also look out for additives or other hormones or chemicals or pesticides that are in food, and identify any food sensitivities or avoid them if there are certain foods that don't agree with you. So when we are under stress, that combination of that chronic stress, your body needs good food so that it doesn't have to work even harder to process it. So when we're starting out our day, so I personally do a lot of intermittent fasting, and I find that's really helpful for my diabetes. But on the other hand, some people really need that food in the morning. And so starting with a good, nutritious breakfast can be very helpful. It also gives that body, if we think of it, breakfast, if we split that word up, it's about breaking our fast. So we fasted overnight, we haven't been eating overnight, and this is our first meal that we're putting in our mouth after sleeping for 8 to 10 hours, ideally, that's actually breaking that fast. So you want to make sure it's a good quality meal that the body's actually able to take from. If you eat a good nutritious breakfast, that can also help with body weight. It can also help with suppressing those hunger cravings that you may have before lunch. Because as we all know, once we get to feeling hungry, our choices of what we eat aren't as ideal. And we go for something quick, something easy, something fast. And that's usually something processed, something sugary to kind of boost our energy levels again. So we also get a lot of our nutrients from our breakfast. And so some people that are deficient in certain vitamins may not be eating the best quality breakfast that their body's able to actually absorb the nutrients from. Yeah, I think that's what I have to say. So about preventing those spikes and dips in our blood sugars. So as you can see, when we eat simple carbohydrate, it's this red line. Our blood sugars go up, our blood sugars come down again. We feel a crash. We eat simple carbohydrate again to raise them up. They crash, and it's a vicious cycle. Whereas the complex carbohydrate is more complex. It's not as fast to break down, and our insulin requirements stay a lot more level with that as well. So eating protein, good quality fats, and reducing our simple carbohydrate and changing that up for more complex carbohydrates can be very helpful for blood glucose regulation. So increasing proteins and the good quality fats, that can include nuts and seeds, olive oil, coconut oil, avocado. Those are just some examples. So this kind of explains that same thing. It's about making sure that if you do notice that during the day you do have lower energy, try and look at what meal you've had previous to that. Has it been something that was quick in and quick out? Or is it something that's more stable and long lasting? Because that'll actually keep you full longer and prevent those dips, which then we go to eating those simple carbohydrates. And always remembering that fruits and vegetables do contain micronutrients and antioxidants, which are great for the body. When we're looking at the nutrition, like simple philosophies, like eating whole foods, I talked about nutrient dense foods. So really getting a lot of nutrients from each bite of that food, avoiding simple sugars. And I don't know who said this quote, but my friend reminded me of it. It's don't eat anything your great grandma wouldn't recognize. And what that means is just like, if it's processed or comes in a can or that kind of thing, they didn't have that, back in the day. And they were really about eating fresh fruits and vegetables from their garden, and the foods that actually looked like the food it was supposed to be. So again, looking at rich in vegetables and second, fruit. So eating veggies first, then fruit, it just helps to maintain blood glucose levels more easily. Vegetables can be eaten in abundance, and each meal should have a plethora of color of vegetable too. So not just eating one color, but try and eat through like the rainbow of different colors of veggies. And again, those are the healthy fats listed below. Good quality proteins such as lentils, meat, but good quality meat, right? Salmon, fish, these are all really great and very nutrient dense for ourselves. Let's now talk about water. There's so many people that are dehydrated that I see in practice. And so I felt this slide was very important. So as you can see on the left, water makes up a huge part of our body. Our lungs, 90%, our blood, 85%, and the list goes on. Hydration helps to maintain our body fluids, keeps us energized. So sometimes it's not that we either have low blood sugars or we haven't eaten enough, but water actually helps to boost our energy as well. It also is a detoxifying, so our skin looks better, our mind is more productive, there's less pain because pain is associated with inflammation. And if you're dehydrated, there is more inflammation in the body. The list goes on with hydration and the benefits of water, but even a 3% decrease in hydration or dehydration can cause fatigue and compromise our brain function. So if you think about it, even breathing, we're losing about 600 mils of water a day just by breathing and what's eliminated through our skin. And that doesn't even include getting up or having a workout or sweating during the day. So really important to maintain good hydration. And sometimes if we're hungry, let's try working on hydration first to see if we're actually hungry, or actually just thirsty. As I said, water purifies and nourishes and refreshes all aspects of our body. It's responsible for that communication between cells. For it's dehydrated, we have a lot harder time communicating with the other cells around it. We require about half of our body weight in ounces of water per day. And I know that everyone knows that like 8 cups of water, but if you're a taller individual, if you're male versus female, that water intake may need to be adjusted for you. And it's another thing is I have a lot of patients come in, they're like, oh, I don't like water, but I drink coffee, I drink alcohol, that's fluids. Those aren't fluids that our body can actually use very well. So water, only water is water. And I will put a caveat of some herbal teas are okay too, but just make sure that that water intake is strong. Then looking at exercise, the benefits of exercise have so many helpful benefits in life, and it can help reduce stress. It helps to actually boost our immune system. Even that slight bit of stress on the body, then our body builds stronger. Okay, it boosts happy chemicals. It improves self-confidence. It improves our mental cognition, alleviates anxiety. We're getting those hormones going. We're boosting our brain power, sharpening our memory. And we can actually also relax better if we've done a workout because our body has been able to use up that pent-up energy. And it can also help promote better sleep. Now let's get into sleep. So sleep is so important, and a lot of people don't give it the energy and attention that it actually needs. So sleep, if we're not sleeping enough, it affects our cognition, it affects how we recover. And that's a huge one, is I deal a lot with pain management in my practice. And there's so many people that are like, oh yeah, I'm so busy, I only slept a few hours. If we're not sleeping, that's our repair and like regenerating time. So if we're not actually giving our body that adequate rest, there's no way that we're actually going to be able to function for the rest of the day in all of the activities we need to do. Sleep can also help with blood sugar control. And not many people actually realize how important sleep is. But if you don't actually sleep enough, I can guarantee that your blood sugars won't be as good as if you do get adequate sleep each night. Sleep can also help reduce ghrelin, or our hunger hormone. If we're not getting enough sleep, you will always be hungrier than if you actually did get a good enough sleep and were able to repair. That being said, also with blood sugar control, it also affects our insulin sensitivity. We'll be more insulin resistant and have to take more insulin for that same amount of food that we're eating if we haven't had enough sleep. Sleep also helps with decreasing stress and our cortisol production, and it helps regenerate our body and repair our body to keep our immune system healthy. Yeah, so it's our time to regenerate, repair, and detoxify. It's essential for health. And even if we're getting less than like 7 hours of sleep a night, even 3 times in a week, your body is much more susceptible to colds and flus than if you are getting 7 to 8 hours of sleep a night. Poor sleep is also linked to a lot of long-term inflammation. And one of the things about diabetes is there is a higher inflammatory process in the body, and that can affect our digestive tract and how we absorb nutrients. It can also affect, as I said, memory, cognition, concentration, and even just how our body repairs. All right, so if we think about circadian rhythm, that's a rhythm of our, so that's our like sleep wake rhythm of our body. And there's many things that actually can affect that. And blue light is one of them. So blue light, which it can be seen on our phones, on our computer, even our TV, if that is too bright before we go to sleep, that actually stops melatonin, or our production of the hormone that helps us sleep. Excuse me. So blue light also disrupts our deeper levels of sleep in our REM sleep. But so that can be a real issue. If people are coming in with sleep issues, I'm usually asking them like, Are you watching TV or on your computer before bed? Are you studying with students? Are you studying up until the exact moment you have to go to sleep? Your brain does need time to turn off and get ready for bed. And my next slide is going to talk about how can we sleep better. Also, not only is it disruptive to have that blue light in the morning, it's actually very beneficial to have it, or sorry, at night, it's beneficial to have it in the morning. So healthy daytime light exposure and in the day and then darker at night can really help set that circadian rhythm for us to help us with that dark night sleep cycle, or light and dark sleep cycles. So ways to sleep better. So important to kind of set a sleep routine. So that means going to bed around the same time each night and waking up at the same time each day, preferably with the sun, although during the winter, it seems like it's up and down way later, or we need to be up for more hours than that. This allows our body to follow that routine of that circadian rhythm and get into a much better rhythm. Also, you want to make sure that your room is quiet and dark. If there's anything that's disrupting either the noise or if there's light in your room, you won't sleep as well. Also, it's important, reserve the bedroom only to sleep. People that do work in their room or they have everything else going on in their room as well, it allows our brain to be like, oh, or am I supposed to work right now? Am I supposed to sleep right now? And that can also affect how you sleep. As I said, reducing blue light exposure in the evenings needs to happen, so that cell phones, computers, TV, turning those off in order to allow that melatonin production from your body to naturally happen. The next one says sleep before midnight. So when we go to bed, any number of hours that we go to bed before midnight actually counts as an extra hour of sleep to our body. So let's just say we went to bed at 10 o'clock and woke up at 6 o'clock. That's 8 hours. But we had 2 hours before midnight. That actually, to the body, signifies about 10 hours of sleep. Whereas if we go to bed at 2 a.m. and 8 hours later wake up at 10 a.m., that's still 8 hours of sleep. But those 2 hours after midnight subtracts from that time. So instead of getting 10 in that 8 hours going to bed before midnight, that 8 hours is now shrunk down to 6 if we're going to bed after midnight. And most people don't realize that because our hormones for actually sleeping are produced before midnight. So if we're not actually getting that hormone production, we won't sleep as well. Make a relaxing bedtime routine. And that means just like having a bath or reading a book or having some tea and starting to just kind of like settle into getting ready for bed. It's also important to avoid alcohol or heavy meals before bed, because if our body's having to work to process through those, it's not able to actually allow us to get a good enough sleep. And avoiding naps during the late afternoon can really help actually allow you to sleep at night. And don't do any work right before bed, because that's just going to keep your mind super active and not allow you to sleep. Also avoiding strenuous activity right before bed, or avoiding strenuous exercise right before bed is advised. And getting morning sunlight exposure can really help to just get the body up and ready for the day. So I talk about sleep support. Sometimes patients may need some sleep support to kind of help, but some like natural, easy ones is just to have like a sleepy time tea. That might be like a chamomile tea or passion flower. Lavender essential oils can also be really great. And if needed, then we can add either some other supplementation or medication if needed. But I like to try actually doing it naturally for the body to see if the body can actually kick itself into that rhythm before adding those extra crutches to sleep. Now let's talk about alcohol. So alcohol and smoking have, and I tailored this to diabetes, but they do affect blood sugar dysregulation. So it can either, alcohol will, like especially beer or wine, are going to increase your blood sugar levels, and certain hard alcohols can actually decrease blood sugars, but it really depends on the timing. Alcohol also stimulates appetite, so we get more hungry, we eat more, and that's also going to affect blood glucose regulation. It's also calories. So if you're watching calories or weight loss is a goal, watching the calories from alcohol, because it's huge empty calories. We're not getting any nutrients from them, like we talked about in the diet section. It can also interfere with the medications that we're taking. And one of the things for type 1 diabetes in particular is with alcohol, it's processed in the liver, and the liver is also produces glucose. And so we get glucose from our food, but our liver also produces glucose. And especially for type 1, it's really important to know that when you drink alcohol, it paralyzes the liver from producing glucose. So if your blood sugars go low, especially after alcohol, which can have a rising effect of blood sugars, but then within 24, 48 hours can actually have a decreasing effect on blood sugars. If you've paralyzed your liver from producing glucose, you can get into a dangerous situation. So I do like to let people know that, and that it does also affect type 2 diabetics in regard to their oral medication. It also increases triglyceride, or the fats in our system. It increases blood pressure. And another huge one to note is that signs of intoxication similar to a low blood sugar. So maybe, you were out and you had one beer with, a friend, and then you got low. Sometimes that can also it'll look like intoxication. You may not get the help that you need, and vice versa, right? So always have alcohol with food. It helps to just slow it down and have less of a spike effect, and not also that lowering effect of blood sugars. I'm not really a fan of diet sodas of any kind, but mixing them with something that doesn't have sugar can also be a way to mitigate blood sugar dysregulation. And wear your medical alert. I know sometimes it can be a hassle to have it, but it is one of those things that can be life-saving, especially if you do get into a difficult situation, because then the medical system knows that you have diabetes and it's not something else. And those minutes or hours difference, if they're trying to figure out what's wrong, if you aren't able to speak for yourself, can be life-saving. So that's mostly on the alcohol side. Smoking has also been linked to a higher rate of type 2 diabetes. It's harder to control insulin levels and blood sugars if you smoke. And smoking also increases other health issues such as heart and kidney disease, poor blood flow to the extremities, which can also be a sign of diabetic neuropathy. It can also affect the eyes and peripheral neuropathy. So this is my end of my presentation. I just wanted to kind of summarize up everything that I have talked about here, and thank you so much for listening. But acute and chronic stress is prevalent in our daily life, and it's about finding ways to manage that. Stress can be linked to chronic disease, but there are things that we can do to help. There are steps that can be taken to reduce our stress in our lives and to help our bodies adapt appropriately in that stress response. Diet and lifestyle are huge factors, and there's something that you have control over in the management of both stress and your diabetes. Hydration is key for cellular health. Sleep is important for so many reasons, and I have handout upon handout on it if anyone would like more information about that. And exercise is also so important for everyone, and it does help to manage your blood sugar levels. Great. Well, thank you so much, everyone. And here's my contact information again. And thank you for attending.
Well, that was wonderful. So much great information. Thank you so much, Heather.
My pleasure. Does anyone have any questions?
Yeah, so now is the time to ask questions. Now I saw somebody put their hand up, but if you could go to the Q&A and ask the question in there, that would be great. Any views on gluten and chronic disease?
Yeah. Yes. So gluten it's a tough one. It can be very inflammatory to the body, which then is causing more stress on that body that's also dealing with chronic conditions. Also, it is, as I said, inflammatory, and that can really affect the digestive system as well. So I usually will do a food sensitivity panel with patients just to kind of show them it's not necessarily a gluten allergy, but it may be a sensitivity, and to just be aware of that, because if they are having other symptoms that are affected by gluten and they can remove gluten, it can sometimes help that inflammatory process from causing more issues.
Excellent. Thank you. Now's your chance, people. If you have a question, please put it forward. What type of magnesium should a diabetic take?
You know what? It depends. So there's different types of magnesium. So it's dependent on what we're needing it for. So if you're needing it for like muscle and relaxation versus helping with digestion, if you're constipated, that would be something to address with your health provider, just to make sure that it's right for you, so that if you don't need it for one or the other, you're specifying where you're taking it and what it's for.
Great. Any other questions? Oh, here we go. What is your opinion of the ketogenic diet to control diabetes?
Cool. Great question. I personally, on a not even a medical perspective, I personally love it for my own blood sugars. I find it very helpful, but you do need to watch your blood sugars more carefully, because if you are on a ketogenic diet, you're not actually ingesting the glucose, and blood sugars can, and they will look lower, especially when you're in ketosis. And that is something to watch as a diabetic, because my blood sugars will look low, but I know that I'm not as low based on that. But it is something to watch very carefully, and just make sure that people are doing it properly. There's two very contradicting schools of thought on it. One is that it's great for blood glucose regulation, and the other is worrying about ketoacidosis. From what I've experienced with diabetics and non-diabetics that I've put on keto, or at least intermittent fasting with like a very 90% keto, it's been absolutely great, and no one has gone into ketoacidosis. That ketoacidosis is more of that high blood sugar ketones that isn't necessarily going to happen when we actually are doing keto with food.
Great. Thank you. And a question for me: will this webinar be kept in a HANS library or made available to share? We will be putting it up on YouTube, and then I'll be sharing it through our social media. So I hope that helps, Camille. And another question: what milk is best to drink? There is sugar in milk. So I guess the question is about milk alternatives as well. Yeah.
So me personally, I'm not a fan of milk. Dairy can be very inflammatory for some people. And I also have a bit of lactose intolerance, so that doesn't help either. But so milks, like the sugars that are like in different foods, you do need to account for that in either your medication or how you deal with your diabetes. I'm not really a fan of milk, so I use more like nut milks, like either oat milk, almond milk, coconut milk. What else have I used? Cashew milk. Those are more options that I recommend for patients. Unsweetened, of course, because there's so many things with just that added sugar that don't really need to be there. And sometimes it takes a change to actually like prefer that, but in the long run, it's better.
What about soy milk?
Yeah, so there's different schools of thought on it. Some people say that it has more like estrogens or estrogenic effects. I wouldn't be consuming it like as a female, well, male or female. It's, if you can like be aware of when you're having soy milk and alternate it with some like other forms that aren't as estrogen dominant. But it used to be that it was like more cancer causing. I don't deal with cancer in my practice, but there has been some like new research that said it's not as bad. So I would still try and like limit it, just in my own personal opinion, but it's not like an absolute.
Okay, great. And another question, and this is interesting because I've heard this too. Alzheimer's has been called type 3 diabetes. Your thoughts?
Yeah. So, yeah, I have read that, and it Alzheimer's can, it plays a lot into that, like Alzheimer's and dementia in regard to like the memory. And there are a lot of, it's not necessarily the insulin or blood sugar response that's considering it a type 3 diabetes, but from that mental perspective. And ultimately, if there is poor blood glucose regulation, that can lead to more of those memory effects, which then they're looking at as causing more Alzheimer's or dementia. Great question, though.
Interesting area, definitely.
So even without being diabetic, like, I mean, if there's any non-diabetics on this call as well, it's also important for you guys to be watching your blood sugars, you know, like as much as your pancreas is producing that insulin, if you're constantly having to produce insulin and you're getting these spikes and stuff, it's still going to lead to certain conditions like this. It's just your body hasn't worn out its ability to do it on its own.
Interesting. Sorry, there is another question here, but there's a pop-up. I'm just going to wait for that to go. What if you are sensitive when you eat increased fruits and veggies, resulting in gastric upset, including nausea, vomiting, and or diarrhea?
Okay, so sounds like there could be some food sensitivity issues or some inflammation in your digestive system. So this would be a perfect reason to go see a naturopathic doctor. I am taking patients if you are in Vancouver and want to come see me. This would be something I'm looking at. Like there's obviously some other layer to this, but fruits and vegetables shouldn't necessarily cause that gastric, but when that is happening, we got to look at what that deeper layer of the issue is. And for the most part, it's usually some kind of inflammation or food sensitivity.
Great. Last chance. Any other questions? I have a really nice comment here that I wanted to share. This was brilliant, easy to understand and concise. Thank you.
Thank you.
And then I got another really nice message. Great presentation. Love listening to a different perspective on diabetes management from a T1D standpoint and as a diabetes educator. So, and lots of thanks.
Thank you. I'm also very open to if people have other questions that come up even after this presentation. Here is my information on the slide. I love being able to help diabetics and even non-diabetics, people interested in it, because I feel the more people that know about diabetes, the more that they are able to help somebody if needed. And so if any other questions come up, please feel free to email me or find me on social media.
Can we fit in one more?
Yeah.
What do you do when you have neuropathy in your feet? When should you go to an endocrine?
So I mean, I always recommend diabetics have an endocrinologist on their health team. The reason for that is because they are sometimes able to like look at different aspects of the condition, right? An endocrinologist deals with like the endocrine system, and diabetes is part of that. When you have neuropathy in your feet, I deal a lot with that in my practice with patients. It depends on, how far it's gone. I mean, if we can catch it early, there are things to help kind of minimize the effects of it. And then if it is more progressed, then we do need to have a more careful look at blood sugars, also on supplementation. Sometimes, one thing I did forget to mention was that sometimes if the digestive system has inflammation or we're really needing to boost nutrients, I do also sometimes tell people to come in for IV, like into the vein vitamins and nutrients, because that allows the body to get a lot more absorption of them, and we can actually get higher doses of nutrients to kind of boost the system, to just kind of give it a jump start.
Makes sense.
But definitely some supplementation is needed if you do have neuropathy to just keep circulation going for the body and minimize any of that nerve damage, right? And then again, if there is neuropathy in the feet, always checking, always checking for if there's any cuts, because as I said earlier, those cuts don't heal as well. And we don't want to find it too late where more severe and drastic measures need to be taken.
Thank you. So one more comment from Mary, absolutely fabulous. Thank you so much for your time and expertise. And I would concur.
My pleasure. My pleasure. Thank you.
So I think that's it.
Great.
Oh, one more question.
Oh yeah, I love it.
But I don't know that this is, yeah, I don't know that you can particularly answer this one. It's about homeopathy and diabetes. Do you practice any homeopathy in your?
You know what? I don't do a lot of homeopathy in my practice unless it's something that like really sticks out to me as a remedy that I can use alongside the other treatment that I do.
Okay. Okay, great. Well, thanks everybody for being here. And if you'd like to stay aware of upcoming Health Action Network Society webinars, please like us on Facebook and follow us on Instagram. Thank you and good evening to everybody. And special thanks to Dr. Heather.
Thank you. Bye.